Operations Center, COVID-19 weekly briefing. Thank you very much for joining us for our briefing today for Wednesday, May 12th, 2021. Today we wish nurses a happy International Nurses Day. Today is commemorated as International Nurses Day all over the world. And today takes on special significance because nurses have been playing a key role, especially in the fight against the COVID-19 pandemic. And so they are to be commended for the hard work that they do. So happy International Nurses Day to all nurses in St. Kitts and Nevis and indeed around the world. I would invite firstly, but before I do that, I want to recognize the Honorable Wendy Phipps, co-chair of the Disaster Mitigation Council, who has just joined us. Welcome. I would invite Superintendent Cromwell Henry, law enforcement officer and member of the National COVID-19 Task Force, to give us his presentation.
Thank you, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. Our Federation continues to enjoy low numbers of COVID-19 cases. This is mostly due to our strict entry and other protocols and the cooperation of you, the public, with our public health and law enforcement authorities. We urge your fullest cooperation with all the COVID-19 prevention measures prescribed, including being vaccinated with one of the approved vaccines. Our medical chief of staff has always said that we can go into community spread as long as our borders are open and persons are entering from COVID-19 hotspots. Our borders include the unprotected and porous beaches around the island. This is where our greatest threat lies. Persons entering the country via this avenue do not follow any of the prescribed protocols, and this puts the country at greater risk for community spread. Having said that, I must inform you that we are currently investigating one of such illegal entries into the Federation through one of our beaches. On Tuesday, 11th May, at about 10:30 a.m., the police received information about a fishing vessel landing at Limekeel Bay and an individual with a suitcase alighting the vessel and running off into the Limekeel village area. The Coast Guard and several police and defense force units responded and found the abandoned vessel on the beach. The surrounding area was searched, but no one was found. The vessel was taken into custody by the St. Kitts Nevis Coast Guard. Our investigation so far has revealed that the vessel was stolen in Antigua the night before. This has led us to believe that the individual possibly came from Antigua. We are well aware of the COVID-19 situation in Antigua with respect to community spread. This has raised concern for us as we do not know the COVID-19 status of this person who has now integrated into our society. We want to assure you, however, that we are vigorously pursuing all leads to find this individual, and we ask for your assistance in this regard. Anyone having information about who this person is or his whereabouts is asked to call the police hotline 707 or 911 and give the information, and you may do so anonymously if you wish. In the meantime, we urge you to get vaccinated or to at least follow all the COVID-19 prevention measures. Avoid crowds and crowded events, wear your mask in public, maintain a physical distance of 6 feet from others, and practice good hand hygiene and other sanitization practices. Thank you.
Thank you, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center Situation Report.
Thank you, Mr. Williams, and good afternoon to everyone. I want to join you, Mr. Williams, in wishing our nurses a happy International Nurses Day. Our nurses are our frontline warriors in our response to COVID-19, and today we pause to celebrate our nurses for the tremendous service that they are extending to our people. Today, May 12th, it's my task, as per usual, to share with you the Health Emergency Operating Center Situation Report. To date, the Federation of St. Kitts and Nevis have reported a total of 45 confirmed cases of COVID-19. 44 of these cases have fully recovered, and so at present we are only monitoring one active case who remains stable. Between last January to present, over 159.2 million persons impacted by this disease, and over 3.3 million persons have died. Concurrently, countries around the world have rolled out their COVID-19 vaccine programs, and to date, over 1.2 billion COVID-19 vaccine doses have been administered. 32.7 million confirmed cases reside in the United States of America, and over 582,000 persons have died from this disease, as reported by the USA thus far. Now, this slide just provides you a snapshot as to what's happening in some territories with respect to the vaccine rollout. Now, in Israel, they would have vaccinated or fully vaccinated about 56% of their population, the USA 35%, the United Kingdom 27%, Canada 3.4%. And this refers to fully vaccinated. The number of cases in the Caribbean region continue to increase, and amongst the CARICOM member states, collectively they would have reported over 167,000 cases so far, and almost 3,000 deaths as a result of COVID-19. In terms of the Organization of Eastern Caribbean States, the OECS territories, a total of 12,311 cases have been reported by the OECS territories collectively, and also about 166 deaths have occurred as a result. Now, like St. Kitts, the Caribbean islands, the OECS territories, they are also administering the COVID-19 vaccines to their people. So in Anguilla, they would have covered 42% of their population. In Antigua and Barbuda, approximately 32%. Barbados, about 26% of the population. Similarly, Dominica, 26%. Grenada, 12%, Montserrat, 22%, St. Lucia, 14%, St. Vincent and the Grenadines, 13%. And these, the coverage I just shared speaks to the coverage as it pertains to the first dose, the administration of the first dose of the vaccine. In St. Kitts and Nevis, as at yesterday, Tuesday, May 11th, a total of 14,968 vaccine doses have been administered in the Federation, with 11,466 in St. Kitts, 3,502 Nevis. Now, this represents 41.6%. So in other words, almost 42% of the target population have been covered with the first dose of the AstraZeneca Oxford vaccine. In terms of the number of persons who are fully vaccinated, as at yesterday, that stands at 1,237, or almost 4% of the target population covered with 2 doses of the AstraZeneca Oxford vaccine. Ladies and gentlemen, we continue testing and we continue our surveillance, public health surveillance. And so everyone who presents at the emergency room at the JNF Hospital, Alexandra Hospital, with COVID-like symptoms, they are tested. So to date, we've tested over 13,900 persons with a positivity rate of about just 0.3%. This just highlights the fact that 44 of our cases have recovered. We only have 1 in isolation, and at present approximately are over 700 persons in quarantine. This figure includes the last batch of students, the RUSVM students who would have returned 1 week ago. So they have completed their first week in quarantine. They have a second week to go, before which they would be tested. Once their results return negative, then they would be free to integrate into our society. Ladies and gentlemen, the Ministry of Health and the government, by extension, we have 2 broad strategies when it comes to the COVID-19 response. And one, we aim to minimize the risk of exposure to the SARS-CoV-2 virus. And so all we are doing, our health and travel protocols, our surveillance efforts, all in an attempt to minimize the risk of exposure of the virus. And so with respect to what Superintendent Henry just shared, again, we need to monitor our borders. Border surveillance, very, very important, because we again need to minimize the risk of entry of the virus into the Federation. And our aim is also to reach the herd immunity. And so we are aiming to vaccinate the adults in our population, and the adults comprise 70% of our population. And so we would like to get there at the soonest. Now, to date, a number of COVID-19 vaccines have achieved World Health Organization emergency use listing. And so there are 5 such vaccines. These are the front runners. 1, you have the Pfizer-BioNTech, and then you have the AstraZeneca Oxford vaccine, which is the one that we are administering to our locals. You have the Janssen-Silags Johnson & Johnson vaccine. You have Moderna. And then just this week, it was announced that Sinopharm, China's Sinopharm COVID-19 vaccine, has achieved the WHO green light. So WHO listed Sinopharm vaccine for emergency use. So this occurred just this week. Now, as we all know, the Oxford AstraZeneca vaccine is a vaccine that's available locally, and those of us who would have accepted this vaccine, once you get your second dose and then 2 weeks would have passed, you would be deemed fully vaccinated. Once you're fully vaccinated, you would enjoy a significant risk reduction in your ability to contract this disease. So this vaccine has a 2-dose regimen, whereby we give you the first dose and you're given an appointment to come back for the second dose. Now, this appointment can be anywhere between 4 to 12 weeks, but most persons so far have been given a 10-week appointment. The WHO recommends that the 2 doses, the interval, should be anywhere between 8 to 12 weeks. we are administering this vaccine to adults only, meaning persons over the age of 18. Ladies and gentlemen, please note that the present batch of vaccines that we have, they have a limited shelf life. What does that really mean? They're going to expire very soon. So by the end of June, the present batch of vaccines will expire. And I pause to underscore this because there are a number of individuals, when you ask and inquire, have you, accepted the vaccine as yet? You are told, I'm waiting. Please note that the present batch of vaccines, they have a limited shelf life. In other words, they will expire by the end of June. And so, just a few hours ago, I got my second dose of the Oxford AstraZeneca vaccine. So I was given the appointment for today, May 12th. And so I kept my appointment. I was very particular in keeping my appointment. So I went and I got my second dose. So far, so good, no problems. I want to remind the persons who would have gotten their first dose, I want you to look at your card this evening and note the date and try your very best to keep your appointment and return for your second dose. And please remember to take your card with you when you go for your second dose. Right? So walk with your vaccination record card, because once you receive your second dose, it will be officially stamped and signed. And so that would be your official COVID-19 vaccination record card. Now, we just got, WHO just published and disseminated an interim document about the AstraZeneca Oxford vaccine. And we note that the vaccines are equivalent and interchangeable for both doses. And so the Oxford AstraZeneca vaccine is manufactured in about by three different manufacturing companies. And so you have the Serum Institute of India manufacturing this vaccine, and you have South Korea manufacturing this vaccine. And so what they're saying is that the vaccines are the same and they are interchangeable. So if your first dose was Serum Institute, you can get your second dose, same vaccine, Oxford AstraZeneca, but it can be manufactured by South Korea. Please also note that this vaccine, the AstraZeneca Oxford vaccine, can be offered to breastfeeding or lactating women. So the Ministry of Health here in the Federation, we are offering the AstraZeneca Oxford vaccine to women who are breastfeeding or lactating. Please note, it's not a live virus vaccine, and by extension, it is biologically and clinically unlikely to pose a risk to the breastfeeding child. However, we are not offering this vaccine to pregnant women at this time. This vaccine is safe. The Oxford AstraZeneca vaccine is safe. It can be administered to persons who are living with HIV. So in other words, persons who are living with HIV may be vaccinated utilizing this vaccine. This vaccine is safe. It can be given to persons who are immunocompromised. So for example, persons with severe diabetes, persons who are taking steroids for other reasons, other medical reasons, they can take this vaccine. Persons with autoimmune conditions may be vaccinated. Persons who've had COVID-19 can also be vaccinated. The science or the literature says that you can allow a month or two to elapse between your recovery from the natural disease, COVID-19, before you can proceed and accept the vaccine. What are some of the benefits of this vaccine? As I've said repeatedly, it is safe and effective. It works well in older people. In other words, it has a fairly good or an acceptable efficacy in older adults. It provides some protection against emerging variants. And when I say that, I mean all the emerging variants of public health concern. So there's a new one on the block right now. So you have the variant identified in the United Kingdom, the variant identified South Africa, Brazil, and now you hear about the variant identified in India. And so what the literature is suggesting is that the Oxford AstraZeneca vaccine provides some protection against these emerging SARS-CoV-2 variants. And it's interesting to note that this vaccine has a very wide global reach, with over 148 countries worldwide utilizing this vaccine as compared to the others. These are some of the common symptoms that our people have been complaining of, or they express, or they describe after receiving the vaccine. Just pain at the injection site. I felt a little pain this afternoon, yes. Some persons complain of a fever, which is relieved by paracetamol or acetaminophen, or just feeling lethargic or complaining of fatigue. But between last week and now, persons who have received the second dose, I have not heard much complaints from individuals who have received the second dose of this vaccine. On April the 27th, the Honorable Prime Minister, Dr. Timothy Harris, he would have announced some policy changes with respect to the reduction in the quarantine period for inbound air travelers who are fully vaccinated. So persons who are traveling to the Federation and those who are fully vaccinated. When I say fully vaccinated, what do I mean? A person or an individual is deemed fully vaccinated if 2 weeks would have passed after having the second dose of a 2-dose vaccine, or 2 weeks after receiving the 1 dose of the Janssen-Silags Johnson & Johnson vaccine. So if you are an inbound traveler who is deemed fully vaccinated, and if you've been vaccinated with any of these, that's the Pfizer, BioNTech, Moderna, AstraZeneca, Johnson & Johnson, you would probably qualify for a reduced quarantine period of 9 days. However, please note, you still have to complete the entry form on our website. You still have to submit a negative RT-PCR test done within 3 days of travel. And once you meet all the requirements, you would qualify for a reduced quarantine period of 9 days. You will be tested on day 9, and once your result returns negative, you would be officially released from quarantine on day 9. Effective May 20, fully vaccinated spectators or patrons would be able to gain access to sporting events like football, athletic meets, cricket, etc. And so I am encouraging the football lovers, as seen in the picture. It's easier. Just go get your vaccine, and you can go inside the park and look at the match. Effective, well, let me just add, yes, if you are fully vaccinated, you can gain access to a sporting event. However, you need to wear your face mask. You must maintain hand hygiene. There will be temperature checks. They're going to ask you your name, and you're going to have to provide some contact information upon entry. And we implore the sporting event organizers that you need to seek approval from the Ministry of Sports along with the Commissioner of Police. Effective July 19th, fully vaccinated cultural events can be favorably considered, whereby fully vaccinated patrons can be allowed entrance to such events. However, again, vaccinated patrons, you would have to maintain hand hygiene, temperature checks on entry. You must wear your face mask, provide your name and contact information, and then there will be reduced patron capacity. Now, we also recommend that all event operators, event staff, and entertainers must be fully vaccinated. Please note, the organizers of these events must first seek approval from the Commissioner of Police. This just highlights that there is a travel advisory for travelers coming in from Brazil, UK, South Africa, India. However, citizens and legal residents returning from these territories, you will not be denied entry. However, you would have to complete the form and you will be expected to quarantine for 14 days. Ladies and gentlemen, let's protect ourselves. Let's vaccinate. Hashtag do not wait, vaccinate. Thank you.
Thank you, Dr. Laws. With your presentation on the autoimmune diseases and that persons can safely take the AstraZeneca vaccine, that raises the first question that was sent in for the day. A doctor said it can cause more autoimmune diseases if you have one already. Is that so?
That statement has no scientific or medical basis at all, and it's completely false. So it doesn't matter who said it. If you go to any reputable medical site and Google it, you will see nothing to support a statement like that. Thank you.
Thank you, Dr. Wilkinson. These two questions are from Vaughan Radio. The first one, how long does it take for travelers to receive the immigration and approval form when traveling, as persons are complaining that the process is taking a bit longer than the time allotted, which is causing some persons to miss their flight? And the second one, as persons are encouraged to take their vaccine, let's say that they agree to take it now. Will it be too late for persons to receive their second vaccine when the time comes? As we have learned that there is less than 10 weeks remaining before the vaccines expire. Is this accurate? If not, please explain.
The first question pertains to inbound air travelers and the process of submitting your entry form, your RT-PCR test, getting approval in order to travel. And so we advise or recommend that if you are traveling, you can go to this website and start to fill out or complete the form as soon as possible. So persons, what they are doing, they are waiting the test result to start the application process, and that would be a challenge. So what we say to persons, once you know you're going to travel, once you have your ticket, log on, complete the form. You have to wait until you get your test because you have to do the samples 72 hours prior to travel, and you may get your result 1 day or a day and a half before you actually board the flight. And so you can easily upload that afterwards. So once you're going to travel, once you have your ticket, apply online, start the application process. When you get your result, just upload your result, and then it will be processed in a timely manner. So I want to share with the public that we have a team of IT technicians who are working 24/7. They work around the clock, and so they monitor the entry forms over every 24 hours. And we approve persons to travel up to an hour before the flight closes at a particular airport. The second question spoke to, well, I'll answer by providing an example. A relative of mine, she received her first dose of the AstraZeneca Oxford vaccine today, and her appointment is the 30th of June. And so it's less than 10 weeks, and because of the shortened shelf life of the vaccines. And so please note that the vaccine interval can vary anywhere between 1 month to 12 weeks. The World Health Organization suggests or recommends that it can be anywhere between 8 to 12 weeks. And so given the shelf life of the vaccines, if you come at this late stage, we will give it to you, but the interval will be shortened. Thank you.
Thank you, Dr. Laws. That brings us to the end of our press briefing for today. Thank you very much for your questions. We, of course, are very happy to give you the answers to your questions as we are all in this together, helping to manage the COVID-19 pandemic here in the Federation. So thank you to Dr. Cameron Wilkinson, our Medical Chief of Staff at the Joseph N. France General Hospital, to Dr. Hazel Laws, our Chief Medical Officer, and as she said, she took the second dose of the AstraZeneca vaccine. We are not just here at the New York press briefings, but we are leading by example. So did Superintendent Cromwell Henry. He has also had his second dose, and the Honorable Wendy Phipps also had her second dose of the Oxford AstraZeneca vaccine today. We are all here leading by example because we believe in the science, and we believe that it is one of the only ways that is going to get us out of this pandemic. We are not buying into the false information, the misinformation, and the disinformation. I want to thank Superintendent Cromwell Henry for his presentation, and we thank also Mrs. Christmas Jacobs for her dedicated service of sign language, which is very important for a very special group within our society. ZIZ, we thank you and all the media who continue to partner with us in terms of the fight against this pandemic with the providing accurate information, timely information, and right information, let me put it that way, with respect to the COVID-19 pandemic. Thank you very much, Vesta, part of the communications team here. Thank you to all of you who joined us for today's briefing. Our next briefing will be on May 26th. So we won't have a briefing next week. We'll have a briefing the following week, which is May 26th, at the very same time at 5 p.m. from the NEMA headquarters. And going forward, our briefings will then be twice per month. So every other Wednesday, unless there is some emergency, but there will be twice per month, every other Wednesday. So see you next week, not next week, sorry. See you on May 26th, week after next. Until then, take good care. I am Les Roy Williams.